How important is inflammation in that line of thought?
Let me take a step back if I could. Just a thought occurred to me while you were asking that question in terms of being a diagnostician. And it's a quote that comes from Louis Pasteur that says that chance favors the prepared mind. And the reason I was thinking about it while you were doing that introductory question is because when you prepare your mind, when you explore other ideas, then you enhance your chances of making that right discovery that can have a major impact on that individual patient that you might be treating that day. That said, even broadening a person's perspective, a healthcare practitioner's perspective, to understand the fundamental role of inflammation in areas that I am particularly interested in, like neurodegenerative conditions, really expands not only the understanding but the therapeutic options, not only in treating neurodegenerative conditions, but actually preventing them. So the question was, how important is inflammation? Inflammation is the cornerstone of Alzheimer's, obviously multiple sclerosis, and also things like Parkinson's. These are fundamentally inflammatory diseases of the brain. And, you know, people don't really recognize that because we're all familiar with the cardinal issues of inflammation, of swelling and redness and pain. But when your brain is inflamed, you're not going to feel it. You're not going to know. But absolutely, all of the chemical markers of inflammation that you might have in an arthritic knee are the exact same players that are involved in the disease that we call Alzheimer's. So where do we go with that information? Well, right off the bat, we can get a leg up on preventing Alzheimer's disease. And again, what did I just say? Preventing Alzheimer's. No one wants to talk about that, but you know, the Lancet Neurology just published reports saying that more than 54% of the current Alzheimer's patient load in the world could have been prevented if specific lifestyle issues would have been addressed. And in this country, that represents about 2.6 million people right now who carry a diagnosis of Alzheimer's, a disease for which there is no treatment or cure, that didn't have to get that situation, be in that situation in the first place. To get back to your question, how important is inflammation? It is absolutely fundamental. Now, people are beginning to get, and I'm giving you the short answer here, people are beginning to get this notion that there's some relationship between Alzheimer's and dysregulation of blood sugar. In fact, to the extent that some people go as far as calling Alzheimer's disease diabetes type 3 because of this profound relationship. And it turns out that this does wonderfully relate back to your question, because it is true that there's this direct relationship between blood sugar elevation and Alzheimer's. As a matter of fact, just last week in the New England Journal of Medicine, a powerful study was published demonstrating even mild elevations of blood sugar, just a little bit north of 100, already correlate with risk of dementia. We know that elevations in hemoglobin A1C are directly correlated with shrinkage of the hippocampus, or the brain's memory center. But how does this relate to inflammation? I'm going to bring it back around. When your blood sugar is even mildly elevated, it raises a process called glycation. And glycation is the process by which that mild elevation of blood sugar binds to proteins. When blood sugar is elevated and binds to proteins in this process called glycation, two bad things happen. Number one, it dramatically increases the production of chemicals that are called free radicals, which damage everything in sight. And number two, glycated proteins, or proteins that are bound to sugar, dramatically increase the process of, as you mentioned, inflammation. And this is devastating for the human brain. So, in a very real sense, we can control the set point of inflammation in our bodies, not by necessarily eating turmeric and taking anti-inflammatory medications. I mean, I'm all for using turmeric and other herbs and omega-3s, etc. But step one, the biggest issue, is to cut back on the carbs. It's the carbs that are the killers, fundamentally, because ultimately a high carbohydrate diet leads to this modification of proteins that dramatically increases inflammation and the production of damaging free radicals, which damage our DNA, our fat, our protein, and really every part of the body. So again, you know, it's interesting to talk about food allergies, food sensitivities. I know we're going to be talking about gluten in just a bit, and but the big issue, the thing that is of importance to 100% of humans on this planet, is the excessive carbohydrates in our diet. And you know, that said, where I'm going with this is really, what is the ideal diet? And we'll get to the gluten-free part in just a moment. But the ideal diet in terms of macronutrients of protein, carbohydrates, and fat is an extremely low carbohydrate, high fat diet, eating more fat and dramatically reducing carbohydrate. And it's a revolutionary, brand new diet. It's only been just the past 2.6 million years that people have begun to eat this food.